You might be wondering how to remember the differences between PMSSY, Ayushman Bharat, and ABDM when the syllabus keeps asking for both scheme details and critical appraisal. By the end of this video, you will be completely clear about what each program does, why they matter for UPSC, and which facts examiners often test. I will explain everything in simple steps and focus on the core ideas that appear in prelims, mains, and interview questions. Let's start with a simple picture. Think of India's health system as a three-story building. Primary care at the ground floor, secondary care on the first floor, and tertiary care at the top. PMSSY was designed to strengthen the top floor, creating AIIMS-like centers and upgrading medical colleges so tertiary care and specialist education become available across regions. Under PMSSY, the government announced 22 new AIIMS-style institutes with emphasis on modern theatres, diagnostics, 750 beds, and strong postgraduate and research programs. The other PMSSY component focuses on upgrading existing government medical colleges by adding specialty departments, more beds, and additional postgraduate seats, so regional imbalance is reduced. Legally, the AIIMS Act gives these institutes a special autonomous status and declares them institutions of national importance, that is, important for autonomy and governance. Now, a short exam tip. Questions on PMSSY often ask about objectives, components, and the AIIMS Act. So remember, autonomy, tertiary care, and medical education focus. But schemes can look perfect on paper. So what went wrong in practice under PMSSY? The CAG report flagged weak operational guidelines, underutilized funds, delayed contracts, staff shortages, and non-functioning oversight committees as major issues. For UPSC answers, link these CAG findings to governance problems such as weak project monitoring, lack of human resource planning, and accountability gaps. Moving to Ayushman Bharat. This is a different layer. Designed to protect families from catastrophic health expenses and to strengthen primary care through AAMs. PMJ is the insurance arm that provides an entitlement of 5 lakh rupees per family per year for secondary and tertiary care, cashless at empaneled hospitals. An important fact for prelims. PMJ has no cap on family size or age, and from 2024, it covers all citizens aged 70 and above, irrespective of income, under the Vay Vandana card. Ayushman Arogya Mandirs, previously called Health and Wellness Centers, convert sub-centers and primary health centers into spots for comprehensive primary health care. ANDs deliver preventive, promotive, curative, and rehabilitative services like maternal care, NCD screening, basic ENT and ophthalmic care, and mental health screening at village and block levels. For mains, compare PMJ and ARMS. One reduces financial risk through insurance, the other reduces demand for costly care by strengthening the primary gateway. Why does this matter for UPSC essays and GS papers? Because you can link schemes to sustainable development goals, financial protection, and health system strengthening. Now the numbers that come up often. PMJ has empaneled public and private hospitals, has saved beneficiary families significant sums, and has high private sector participation in claims. But critics worry about budgetary trade-offs, heavy private sector role, shortages of trained staff, infrastructure gaps, and fraud. Mention these in balanced answers. Next, the Ayushman Bharat Digital Mission aims to create a digital backbone so patient records, provider registries, and health IDs become interoperable across the country. ABDM components include electronic registries, a federated personal health record framework, national analytics and supporting layers like ABHA IDs, and health facility and professional registries. For prelims, remember ABDM was piloted in 2020, rolled out nationally in 2021, and focuses on portability, consent-based records, and open standards. For mains, discuss benefits such as continuity of care, reduced repeat diagnostics, and system efficiency, while also weighing risks like data privacy, digital literacy gaps, and potential commercial misuse. A compact way to structure a mains answer is objective, architecture, achievements, challenges, and policy recommendations, and use current figures sparingly to support claims. Coming back to common exam traps, many aspirants mix up PMSSY's tertiary focus with Ayushman Bharat's insurance and primary care focus. So always state the level of care targeted. Remember this simple mnemonic. PMSSY equals Specialist Schools and Hospitals. PMJAY equals Payout for Patients. AAMs equals Access at the First Step. And ABDM equals Digital Backbone. Quick recap. PMSY builds and upgrades tertiary institutions. CAG found governance and implementation flaws. PMJ insures families for large hospital bills. AAMs strengthen primary care. And ABDM digitizes records. Exam relevance. Expect factual prelims questions on objectives and launch years and analytical mains questions on implementation challenges and policy trade-offs. For evaluation, always connect scheme design to outcomes like reduced out-of-pocket expenditure and to constraints like low public health spending and human resource shortages. And towards the end, we will understand a key idea that most UPSC aspirants miss: how these schemes are interlinked and must be read together to assess systemic reform rather than in isolation. In practice, look for synergy examples in answers. How AAMs reduce demand for tertiary care that PMSY targets, and how ABDM can improve claims processing for PMJ. If you frame answers that link objectives, implementation, empirical outcomes, and CAG findings, you score highly in both mains and interviews. To prepare smartly, make a two-column note. One side for scheme features and timelines, the other for challenges, CAG recommendations, and exam utility. Keep one or two case studies ready, such as CAG observations on PMSSY delays or reported fraud patterns under PMJ, to make your answers crisp and evidence-based. You're doing the right kind of focused study when you move from memorizing schemes to analyzing why they succeed or fail in different states. Stay curious about implementation stories and policy critiques, because UPSC values balanced and context-rich answers. Thanks for listening. If you want structured notes, practice quizzes, and answer frameworks on these topics, continue learning with EduRev. Join EduRev for concise summaries, mains perspective, and prelims practice that ties these health schemes together for exam success.